I'd like to introduce our two speakers today. Dr. Sherry Zorn is a pediatrician and a quality improvement coach. She is an immunization advocate with a passion for improving immunization workflows in clinics across Washington state, making it easier to do this life-saving work. Dr. Maria Huang is a general pediatrician in Olympia and co-chair of the WCAAP Vaccine Committee. Over to you, Sherry.
Thank you, Ian. Maria and I are really pleased to be here today to introduce our newly developed childhood immunization toolkit. I hope you're as excited for it as we are. This was developed with pediatric and family medicine health professionals in mind, and we're really grateful for many of our partners who've helped us, particularly Dr. Seema Abbasi and Deanna Pittenger for their tremendous contributions. So vaccines are important. Globally, vaccines have saved more human lives than any other medical invention in history, preventing nearly 4 to 5 million deaths annually worldwide. And in the United States, routine childhood immunizations provide substantial health and economic benefits as well. This 2024 MMWR report shares that among approximately 117 million children born during 1994 to 2023, routine childhood vaccinations will have prevented approximately 508 million lifetime cases of illness, 32 million hospitalizations, and over a million deaths. And this is a net savings of 140 billion in direct costs and 2.7 trillion in societal costs. So the importance of the work you do every day to provide these immunizations should not be underestimated. And as you know, this work isn't easy. This work has gotten harder in the 5 years since the COVID-19 pandemic first started. Childhood immunizations are in a precarious position right now. The scales are tipping. With decreased vaccine confidence, especially in some populations, we see decreased vaccination rates and the resurgence of vaccine preventable diseases. Measles cases have already topped 1,046 cases nationwide this year. That's the second highest case number in the past 25 years, and we've already had 5 confirmed cases in Washington. Pertussis cases are higher too. In 2024, there were over 35,000 cases of pertussis in the United States, and over 2,000 of those were in our state of Washington. And this year in Washington, we've already had 1,217 pertussis cases as of mid-May, with most occurring in Spokane, Clark, Snohomish, and King counties. With declining childhood vaccination rates, we can expect to see all this more frequently, an increase in frequency and size of outbreaks. This timely modeling study, published just last month in JAMA, estimated the number of cases and complications in the United States under a variety of scenarios for declining childhood vaccination rates for measles, rubella, polio, and diphtheria. I'll just call out a few things on the MMR vaccine. So with our current levels of MMR vaccination, they predict over 850,000 cases of measles over the next 25 years. And if the MMR rates decline by about 10%, the number of measles cases will jump to over 11 million in 25 years. This is really frightening. The good news, however, is that with just a 5% increase in MMR vaccination rates, the number of measles cases would plummet to only 5,800 cases in 25 years. And what this really means is that every child vaccinated makes a difference to our immunity in our communities. So that's community immunity. And this underscores the importance of the work that you do. This graph shows our Washington State immunization coverage rate trend for 19 to 35-year-olds as measured in WAIIS, our state registry. Although data in IIS tends to underestimate the true rates due to the way that the information is collected and managed, the important thing to notice is the trend over time. So vaccination rates, and this for MMR, DTaP, and hepatitis B, and the entire kind of toddler series, that was relatively stable between 2017 and 2020. And then in the 5 years since the pandemic began, we see coverage rates have declined consistently of almost 6 percentage points in that time. For instance, MMR rates fell from 83% to 75.5%, and the rates for the fourth DTP fell from 72 to 76%. And as in all states, we have pockets and communities with even lower vaccination rates, which are really the most vulnerable to outbreaks. So, with all these challenges in mind, Washington State Department of Health asked us to develop an immunization toolkit that would help address barriers and support healthcare professionals, particularly in the childhood age group. So, first, we looked to identify barriers in the 0 to 3 age group, including hesitancy, of course, but we also intentionally looked for any barriers that we could help solve more easily, the so called low hanging fruit. We wanted to know what clinicians needed most, and then we collected resources that would help and practical tools with the goals of simplifying workflows and helping increase childhood immunization rates overall. To identify barriers, we held listening sessions and did a statewide survey. Some of you may have been, who are in the audience today, may have participated, and we thank you for that. We conducted 6 listening sessions with 5 diverse clinics from 5 counties and 1 refugee organization, and we also got input from our DOH and Washington Chapter AAP partners. Then we did a statewide survey of healthcare professionals. We had about 200 responses with a good distribution across roles, practice types, and counties. About 47% of the respondents were physicians, nurse practitioners, or physician assistants, and 34% were nurses or medical assistants. Results are really quite similar when we sorted by rural versus urban and pediatrics versus family medicine. In the listening sessions and in the survey, we asked about immunization barriers such as hesitancy, their family or parent barriers, and clinic workflow barriers. And again, with a special focus on the 0 to 3 age group. For the listening sessions, we asked about favorite tools and resources that clinics were already using that made the work easier, so we could share those with others. And we bounced off some ideas of tools that we were thinking about to get their impressions. We also asked them about requested tools. What would be the most helpful in their work? So here are some of the survey answers. This question was about vaccine hesitancy challenges, and as expected, the most commonly reported challenge was misinformation or myths about vaccines, followed by concerns for vaccine safety, cultural religious beliefs, and the fear of discomfort for their child. And notably, 33% of the respondents reported that vaccine hesitancy reflected a general lack of trust in the healthcare system, especially since COVID. I think we've all experienced that in our own clinics. When we asked the healthcare professionals about barriers that families might face that might prevent them from getting the immunizations on time, the top 3 were the desire to space out vaccines, requiring more time, more visits, the lack of awareness of when the vaccines were actually due or when well child visits were due, and a lower priority or value placed on the well child visit due to competing family priorities. And providers also reported that some parents had transportation issues or couldn't take off work to get to the clinic to make the appointment during regular clinic hours. So that was really an access issue. Our listening session participants also shared that some families may miss a shot or a visit, get off schedule, and then they don't realize that they're behind on the immunizations for the wild child visits. And so they had actually requested if they had only a way to let them know, when these visits should happen. And additionally, language barriers can be an issue for some communities and low literacy, making it hard to understand the written materials that we often give to patients. Now, in regards to workflow challenges or operational challenges, the top barriers were challenges for outreach, either not having time to do it or not knowing how to do it, limited appointment availability, staffing issues, and language barriers. And interestingly, several respondents reported issues with vaccines being intermittently out of stock. Now that wasn't even one of our suggested answers, but it was people wrote it into the open response field. And we've shared that feedback with our DOH partners who will be working to address this barrier and figuring out where those issues are. Because we know there's nothing more frustrating than having a parent willing to vaccinate and then having the vaccine being out of stock. It's frustrating for the clinician and it's also frustrating for the parent. So based on our listening sessions and our survey, we asked about what tools did they want. So the most requested tools were posters so that clinics could easily share the importance of well child visits and immunizations. They wanted training materials and resources that would make vaccine communication easier, the recommendations more effective, and really help answer those harder questions about vaccines that sometimes parents want to know. And also tools to improve the vaccination experience and providing culturally specific tools when they were available. Clinics were also interested in workflow tips to help streamline the vaccination process and make outreach easier and more effective. So with all of that, we developed the toolkit. And we got to work, we created this really robust child immunization toolkit. There are four main components, which Maria and I will go through in detail in the next several slides. So first we created a well child poster, then an immunization schedule poster, a take-home card for families, and a robust resource ebook. So first, let's talk about the Well Child poster. It's an eye-catching and inspirational way to promote the value of well child visits, and in turn, hopefully it will increase the vaccination opportunities. We know that families don't always understand the purpose of these well child visits and all the things that we're doing to optimize their child's health, so this poster really aims to change that. The content is based on the AAP's Bright Future schedule. On the left side, we have what to expect, and on the right side, we have when to schedule. The QR code links to the information about well child visits on the AAP's healthychildren.org website, which we know is a trusted website, and parents can look up, what to expect at each age. And then there's at the bottom, there's space to add your logo, which I will just tell you is super important for all these tools, because your families want to know, they trust you and they want to know what resources you believe in. Now, I'll just quickly mention it's formatted in two sizes. And if you have enough wall space, I'd go for the bigger poster size. Who wouldn't want to look at this adorable little girl painting her bright future every day, right? All right. Now, next is the immunization schedule poster. We've used similar versions of this poster in many of our clinics that have done our quality improvement projects with the chapter. And clinics find that posters work shockingly well to help with vaccination workflows. They promote a standard schedule within the clinic. They're a talking point and a visual cue indicating that vaccines are important and routine. And finally, families really appreciate the transparency and knowing what's next so they can prepare their child. Staff and providers often report that the posters help reinforce their strong recommendation. The QR code on this one points to family-friendly information about immunizations also on the healthychildren.org website. And a couple of things on this, I would recommend, before you use it, you'll want to customize it to your clinic schedule. Which combination vaccine do you use? Do you use the 2-dose or 3-dose rota? Things like that. Then you'll want to verify that the schedule is accurate, and you possibly will need to adjust it, yearly or so, so it complies with the latest CDC guidelines. We know that they're changing sometimes. And then you'll add your logo. Again, it's extremely important so that your patients know that this is what your entire clinic follows. And I also just mentioned, feel free to change the photos if desired, if it would better reflect your community. Finally, we have a take-home card, which is a handy reminder for both the well child and immunization schedule for young children. We kind of mash those two resources together, and parents can keep it posted on their refrigerator or their bulletin board. And again, after you, customize it, then verify it, and then put on your logo and also your clinic phone number and address so that it's really easy for families to be able to schedule a visit. Now, you might say, well, how will I get these templates? So we've designed these posters and the take-home card on Canva, which is an online design service. Some of you may be familiar with it. And we'll share the template links and the customization instructions on our webpage. And at the end of the webinar, we'll have a QR that takes you right there so you can start exploring. And our hope is that you'll use these templates and tailor them to your clinic and your community, customizing the text and images as needed. And then again, after making customizations, verify for accuracy. Then the next step will be to print it. So you can either print it at a local print shop or an online service. I often use Vistaprint, partly because they have good prices, great product, and they provide lamination, which makes the posters more durable. And again, if you buy in bulk, generally at any printer, it's going to be cheaper. Now, if you don't laminate, the posters, you may want to consider using an inexpensive frame so that they last longer on the wall. Then the final step is really displaying them, and we find that they work. These types of posters work really well in exam rooms, lobby, and other public spaces. And final thing is we've actually had our Department of Health partners have translated our materials, these 3 materials, into 4 languages. So are English, Spanish, Russian, and Vietnamese. And if you make customizations on the English version, you'll have to go in and make customizations on those other languages as well. It doesn't automatically populate. And our final tool in the toolbook is our resource ebook. Now, this is really robust. It's filled with more than 35 trusted, practical, and user-friendly resources to address the common concerns of parents, families, and healthcare professionals. And we know it's really hard to keep track of electronic resources. So we've collected them all in one place for easy access. You can either download the ebook and keep it on your computer, or you can access the toolbook of the ebook on our Toolkit webpage. And we want to point out that throughout the resources, we've color coded the references based on the intended audience, so that the healthcare professional can easily access the resources that would be appreciated by parents, and then they can share those. And as we developed this ebook, we sifted through dozens of trusted resources to find the ones that really resonated with us. And in order to be included in our resource ebook, they had to pass our test. Like, would we use this in our office? Would it help with our workflows? Would we refer our families to these sites for more information on immunizations, especially to get answers for those tougher questions? And as we collected these resources, we really made sure to include a mix of trusted sites. Some you'll be familiar with, some will be new to you, but we wanted to make sure that they provided unique and practical tools in a variety of formats. And so now I'll hand it off to Dr. Wong to highlight a few of our favorite resources. And so you can see what we've included and start thinking about how you might use them in your own setting.
Thank you so much, Sherry. And good morning, everyone. Thanks for being here. Early morning, but on a beautiful sunny day. So I wanted to share with you how I've used some of these resources in my own clinic. And this first slide here shows some training resources. So we know that vaccine conversations require a lot of time and patience, but we are still one of the most trusted messengers, and making a strong recommendation for vaccines does make a difference. So this slide shows a motivational interviewing training resource for healthcare professionals from the Johns Hopkins website. And then this one on the right is from the Vaccinate Your Family University, and it's geared more towards like community health workers and clinical staff on how to have these conversations. But we know that a unified and consistent message is important when patients come to our clinic. Next slide, please. So I really love this resource. It's from immunize.org, and this one QR code can link you to the immunize.org website, which has the vaccine information sheets in over 40 languages. So I think I counted like 49, which is amazing. And I actually used this QR code yesterday when I was at a high school vaccine clinic with a family that spoke Hmong. One of the great things about this too is that you're not in clinic kind of shuffling through all those VIS sheets trying to find the specific vaccine for the correct language. So it saves a lot on time and paper. The other benefit of these QR codes is that it always takes you to the most updated VIS sheet. So you don't have to keep track of, when this one comes out or which ones are updated by the CDC. Next slide, please. So I really like this video that was put out by the Children's Hospital of Philadelphia, and It's a child-friendly video. It's only 2 minutes and 18 seconds, and it walks through the process of a child coming into clinic, registering all the way through to getting their vaccination. And I've shared this with families, and I think kids really like watching it. It's cartoon style and just knowing what to expect. Um, and so this really segues, the video actually segues really nicely into our next slide. So the Meg Foundation is a website that's solely dedicated to decreasing pain in medical settings. And I really have used this website a lot because I think for most caregivers and parents, the anxiety with vaccines is probably even more in those adults than definitely in babies and sometimes in the kids. And we know that cry of your baby or your child really elicits this strong emotion in you. And I think for some caregivers and parents, it feels like, oh, I'm listing, causing this pain for my child. And it makes them feel guilty. It makes them feel bad. And it can really cloud their judgment and their decision making. And so, even though the long-term benefits are huge in that short term, it's like, oh, I don't want to hurt them. So we'll just hold off on vaccines. And so I think making this extra effort with this POKE plan really makes a difference. And so the Meg Foundation has these POKE plans on their website for different age groups. And it really talks about things like how do we decrease pain? You can use um, a vibrating buzzy bee that has this ice pack with it, so it kind of numbs and vibrates at the same time. I have one that's a little ladybug and it just vibrates and kids really like that. You can also use a shot blocker, which is something that helps distribute kind of the pain so it's not all localized in one injection site. And then there are things like numbing cream, like EMLA, that can help decrease that pain as well. And these POKE plans, like I said, are for different age groups. And so for some of the older kids, it talks about, ways to take deep breaths. And it's so important for parents to take that deep breath too, because I think kids definitely can sense the parents' anxiety. And so other things like for younger kids, bringing, a stuffy animal that they love, or even like I have some kids blow bubbles in my exam rooms, and it really helps take their mind off of what's coming. Okay, and then next slide. Okay, and then so this is a great resource for specific communities. And so this was put out by the Somali Health Board in King County. And basically it's like a comic book that that can really help, communities when they're able to see pictures of people um, who speak their own language and who wear kind of similar dress that they wear and have the same skin color as them. And so I was at the Equity Summit recently, and Dr. Anissa Ibrahim shared a great story how in 2009, during the swine flu, the H1N1 pandemic, many of the folks in the Somali community, who are predominantly Muslim, thought they didn't need the flu vaccine because they didn't eat pork. And so this just shows like how a simple comic book can really help for culturally specific needs in different communities. Next slide, please. And then this is the last resource I'll talk about. So this My IR Mobile, I think families probably appreciate this resource the most out of all the vaccines. So if they, and I have one of these up in my exam room as well, but if they link to that QR code, it takes them to a login and they can access all of their children's immunization records and their own on their phone. And so that is so convenient because, you know, you don't have to call the doctor's office to get the vaccine records to send to school. And that saves time for the families and the clinics. And we also know that it's nice to have that that second resource. You know, a lot of families have the cute little green vaccine book that they get at birth and then are just really distraught if they misplace it or they lose it. So this is a great way to have the vaccine records available to them at all times. And then next slide, I'll hand it back over to Sherry.
Great. So thank you, Maria, for sharing your how you've used some of those resources. But this is another one. This is brand new, and this has been co-created with our team and the DOH team. And basically, you know, knowing that it's really hard to do outreach, especially in an under age 3 group, we decided to, you know, co-create this tool that would teach clinicians or vaccine coordinators how to do reminder recall that would really be specific to those younger age groups so that they could use IAS to outreach to patients who are overdue for vaccines at multiple times along the way, kind of reminding them along the way instead of waiting until they're so far overdue. And so you'll find this short video, it's only 7 minutes, and the tip sheet to be really helpful step by step to and then you can run your patient list of who's overdue and look them up and figure out, oh yeah, this one we should definitely call or send a letter to, or oh no, this one we know that you know they already know that they're behind. So check that one out. And then finally, how do you get to the toolkit? So let's pause a moment so you can use your phone and point it at this QR code. This takes you to our childhood immunization toolkit webpage. So what you'll want to do is you're going to want to open the toolkit, bookmark it, explore the ebook, get familiar with the resources and identify your favorites. Then you're going to want to open the Canva templates and start customizing as needed. And after you've made your customization, print them and most importantly, display them. And then please share this toolkit with others and share your favorite resources with others too. And with that, our presentation is ended. We thank you very much for joining us to learn about the toolkit, and we hope you'll start using it today. We welcome your feedback about the toolkit as well. And so we'll stop recording, and then we'll have a few minutes to answer questions.